Now, building upon the insights from the joint external evaluation conducted in 2017, Nigeria has taken a significant step towards bolstering its preparedness for disease outbreaks by launching a national plan for health security workforce 2023 to 2027. The plan addresses gaps and loopholes that the previous 2019 to 2023 human resource for health policy failed to cover comprehensively. The Director General, Nigerian Center for Disease Control, at the dissemination workshop yesterday in Abuja, said that efforts are strategically designed to curb the phenomenon of brain drain within the health sector. Benedict Uku has more on the story.
In 2017, a joint external evaluation highlighted Nigeria's preparedness for disease outbreak. The evaluation revealed gaps and recommendations, including the development of a comprehensive strategic plan for the national public health security workforce. Nigeria took action based on the JEE recommendations, and today in Abuja, the Nigeria Center for Disease Control launched a national plan for health security workforce 2023 to 2027. Speaking at the dissemination workshop, the Director General, Nigeria Center for Disease Control, represented by the Director Human Resource and Administration NCDC, Yakubu Abdullahi, stressed that the document encompasses critical components such as capacity building, training, and education of the health workforce.
Health security workforce, we just came up. This is the first time we ever have the plan. And I believe with the momentum we've gathered, it's going to be driven faster, much faster than what we used to have as human resource for health. Because we've already identified, we have a compendium of who are the public health workers. And there's already a registry, national registry, not just at the federal level, even at the sub-national, those public health workforce have been, built into our registry, and we know we have a map. We know where they are. We know how many are in each of the states and local governments as well. So it's actually a good move, which the implementation is going to be very effective.
The Minister of Health and Social Welfare, represented by the Director Health Planning, Research and Statistics of the Ministry, Kingsley Analue, echoed the government's commitment in ensuring adequate human resources for health and support to its citizens.
You cannot stop migration. Migration is a human right. You cannot stop it. But what do we do to make sure that we are not pushed to a wall where we cannot have enough human resources to cater for the services of people who need them? All these things are geared towards to make sure that the people of Nigeria receive maximum healthcare delivery system.
Public health consultant Dr. David Olayemi called for collaborative efforts among various government agencies to ensure the successful implementation of the plan.
Just like the policeman is preparing to make sure that criminals are kept at bay, we also need to see diseases as criminals. What we have done now is to see what needs to be done. What are the first steps that we need to take to make sure that health workers who are in charge of preventing disease outbreaks are properly motivated to do it and do it right. Not just once in a while, but to do it right all the time. This plan now has been finalized. There is a need for concerted effort at the highest level, of government, to ensure that money is released at the right time and with accountability to ensure that this one is implemented effectively.
Nigeria's healthcare workforce has faced the challenge of constant emigration to developed nations where opportunities and better working conditions abound. The Director, Department of Planning, Research and Statistics, Fatima Saleh, on our part gave an overview of the document.
It's actually addressing a lot of issues in terms of the training and education of the health workforce. Right? Their interest in terms of having a fulfilling career is also key. And that is why this document is also addressing, apart from their education and their training, is also addressing their career pathways so that they'll be able to focus on this career, a particular public health profession as their career, to run with it.
With a comprehensive approach laid out in the plan, Nigeria strives to bridge existing gaps, retain skilled healthcare professionals, and ultimately safeguard the health and safety of its population.